So I've been in public health for over 40 years now. And I'm going to tell you 3 things that I learned in public health. And this may well be all you need to know. You may not know what to do with it, but it may be all you need to know to figure out public health. The first thing is that health is a function of social inequality. The more social inequality in a society, the more health inequality. This is why the United States, the richest country in the world, in terms of our health status, is at the bottom of the 16 to 18 highly economic developed countries. We're at the bottom, richest country in the world. And it's because we are the most unequal of all these countries. The second thing I learned in public health, and I learned this very early on, that public health is, yes, it's about science, but science informs, it doesn't determine. We understand science through a particular lens. And what I learned in public health is that lens that we understand the world through is the lens of social justice. And it is the complement to the idea, to the empirical reality, that social inequality is linked to health inequality. And what I mean by social justice, in the simplest way, social justice is about the collective decisions we make as a people, as a community, as a society, about how we distribute goods and services, opportunities and burdens, benefits across the population, because this is not a random distribution. Disease is not randomly distributed in our society, and for sure, opportunity is not randomly distributed in our society. It's just not out there to jump up and grab it. It's out there in a very selective basis. The third thing that I've learned more recently that I think ties this all together is this notion that I'm going to talk about, the developmental origins of health and disease. And I believe this changes everything. But I say maybe because I'm not sure that having this knowledge, we understand what to do with it. Developmental origins of health and disease basically tells us that a lot of what we thought about disease was wrong. Chronic disease, heart disease, diabetes, hypertension, stroke. We thought these things occurred later in life, but we now know that these diseases begin at the earliest possible stages. What we also understand is that our genes, which we all think that genes is what it's all about, right? Somebody dies young, first thing you say is, oh, boy, they must have had bad genes. But what we now understand is that genes are not really a rigid blueprint for our health. But our genes represent a range of infinite possibilities for our health that are activated or not activated by our interaction with the environment. This is what epigenetics is about. Genes account maybe for 10 to 12% of disease. Everything else is caused by something else. And we now know that that something else is embedded in the environment. Where did all this come from? I had the opportunity to work for several years with Dr. Barker, English physician, epidemiologist, really iconoclast. The reason he was an iconoclast was because in the 1980s he was looking at maps of England, and he saw a really interesting thing. He saw areas of England that had high levels of infant mortality also had high levels of heart disease. What was the relationship here? It's a cross-section. It's looking at it at the same time. What's the relationship? And he developed a hypothesis that heart disease actually begins in the womb. It's not about your genetics plus whether you smoke or don't smoke, and you end up getting heart disease or stroke, hypertension, whatever the case may be. Something was going on in the womb, and people thought he was crazy. It's like when Galileo said, the earth revolves around the sun doesn't revolve around the earth. Because from a medical perspective, everybody thought Genes were the center of the universe. And you know what happened to Galileo when he said, wait a minute, the church didn't like it because they needed the earth to be the center of the universe. So people set out to find data, as David set out to find data. David set out to find data that supported his hypothesis, the notion that early life programming led to chronic disease. And other people set out to find data to disprove what David had found. And the database that David had was a location in England, a shire. And in England and in Europe, they keep a lot better health records than we have. And what he found was birth records from the 1920s where they had followed people into the 1970s and 1980s. And sure enough, what David Barker found there was that birth weight was related to heart disease. The lower the birth weight, the higher the probability of heart disease. He found that children born at the lowest birth weight, when he followed them up 50, 60 years later, if you were born at the lowest birth weight, you had a 3 to 5 time probability. In public health terms, this is enormous. A 3 to 5 time probability of dying from heart disease among men. Later research extended this to women, and the relationship between diabetes and low birth weight was even greater than heart disease. Other people, again, ridiculed him, sought out data, but the more data they found, these databases in Finland and China and all these other countries where they had kept records, it validated rather than invalidated what David Barker had found. What he found was that, and this was hypothesis, was that it's not birth weight in itself. This was his hypothesis, not birth weight in itself, that's just a number. But it's what birth weight represents. And birth weight represented nutritional deficiency and social disadvantaged position of the mother. And those two things affected the growth rate of the baby. The baby did not have enough to adequately grow to the fullest extent. So it economized it. It made trade-offs for its survival. And that meant it had relatively slow growth and ended up at very low birth weights. We now know, by the way, that this is a U-shaped curve. Low birth weight, very high risk of disease, comes down, there's a sweet spot, and then when birth weight goes up very high, it ends up to increase the risk again. So what was this all about? David hypothesized that it was our environment that was affecting this. He didn't know what the mechanism was, but he knew, being a physician and a medical researcher, that the most sensitive time for organ development is the first 1,000 days from conception, even pre-conception. First 1,000 days up until about age 2. By that time, most of our organs, except for the immune system in the brain, by the time we're born, are fully formed. So trade-offs that were made because the baby wasn't getting enough nutrition, or a second level, the baby was suffering what's now known as toxic stress because the mother was in disadvantaged circumstances, was forcing developmental changes that set the risk of chronic diseases at birth for the longest period of time. This was revolutionary. This changed everything. There's now an international organization called Developmental Origins of Health and Disease that celebrate David and the work that he did, and that pursues this in lots of different research ways. And we're doing it here at PSU and at OHSU. Think about it this way in understanding this. There's a double hit that goes on. The developing baby is getting messages from the environment through the mother. They're getting two kinds of messages. Number one, what kind of environment is it out there in terms of food, nutrition? Because it's always been scarce. Remember, evolutionary times, we've always had scarce food. So if they're getting a message that nutrition is scarce, nutrients are scarce, then they start conserving, they start making trade-offs in terms of which organs get the energy. At the same time, they're getting messages through the mother from the environment about, is it a safe environment out there? In women who are pregnant in situations of high economic insecurity, low education, high danger, stress about housing, they are getting a message from the environment. They're stressed out. That stress turns into the hormone cortisol, which is transmitted to the baby. The baby then actually wires itself in terms of a stress response system based on this message from the mother that this is a hostile, dangerous environment. So here's what we have. We have a first hit and a second hit. The first hit is the vulnerability the baby is born with based on the information that is transmitted through the mother to the baby that requires the baby to go into survival mode because the baby is doing everything it can to maximize the resources it has and survive. So that's the first hit. But what we know now is that that's just vulnerability. That's not biological determinism. Nobody's born perfect. Whether and the extent to which that initial vulnerability turns into disease, disability, early death depends on the subsequent environment that occurs there. If the environment is a supportive environment with low levels of stress, with adequate nutrition, then the likelihood of disease evolving from that vulnerability is a lot less. Let me just give you an example. My niece had a very low birth weight baby. She's gotten, with her husband, the very best medical care, monitoring, and the child has grown into, very healthy young child. And she's still going to have some risk for chronic diseases maybe that are slightly elevated, but because the environment has supported that growth, the risk is going to be much lower. Let's now take a woman, say, in outer Southeast Portland. High economic uncertainty, fearful about being evicted, doesn't have enough access to nutrition despite Amelia's program, but is helped by that nonetheless. Low levels of education, not a lot of strong community support possibly. She has a low birth weight baby. The environmental impact on that baby is going to have a very negative effect compared to the previous scenario that I provided you. So what we can do is we can think about what is that initial vulnerability? What can we do through prenatal programs and so forth to try and prevent some of that vulnerability? By the way, this vulnerability may stretch into a previous generation as well, which makes it more complicated. But now we have the second hit. Can we do something to prevent the second hit? Can we design environments that are much more supportive through housing, through education, through economic opportunity? And by preventing that second hit, we may be preventing the next generation, we may be helping the current generation, also preventing the next generation from having this problem. The Robert Wood Johnson Foundation had a national report they put out, and there's a wonderful quote. They said, when it comes to your health, your zip code may be more important than your genetic code. We now know that if you look at differences in zip codes, you can find life expectancy differences that may be as much as 15 years different, just in zip codes that may only be 10, 20 miles apart. What we now know through this process that David Barker began to describe, the way the environment provides signals through the mother to the baby, we now know the biological mechanism by which your zip code translates into biological impact that affects your life chances about chronic diseases, and by the way, some cancers over the course of your lifetime. And that's the epigenetic process. Basically, what we know is that these environmental stressors impact the way that genes are turned on or turned off. So genes that should be turned on may not be turned on because of this changes in response to environmental stressors and the other way around. The other thing I need to tell you is that what we also know is that these stressors, both nutritional and social stress or toxic stress, also affect cognitive development. So babies bathed in cortisol in the womb, and then subject to high levels of stress once they're born, and some of you may know about ACEs, adverse childhood experiences. They don't do well in school. In fact, we see a straight relationship between birth weight and school test scores. It's not a dichotomy, it's not low-high, it's just a consistent relationship. And what we know is that these kids have memory problems, they have executive function problems, they have problems getting along with other kids, and what this tells us is that the very skills that they need to be successful in life are being compromised from the moment they're born. So there's an old saying, Thomas Pynchon, some of you may have read Gravity's Rainbow, if they can get you asking the wrong questions, they don't have to worry about the answers. What this science tells us is we need to rethink the questions we're asking about when disease begins. What keeps people healthy? What is the relationship between biology and sociology? There's no longer a nature-nurture difference. These things work together. And what we have to do is we have to redesign everything we do about health to move upstream and to address the environments into which these children are being born so we can help them and change those environments so subsequent children won't have the same sort of initial disadvantage. "18 years ago when I left Berkeley, a colleague of mine, a guy named Herb Chow-Gunther, who's just a massive social activist, has done just incredible stuff. He's half Chinese and half German. His mother was Chinese. He gave me this Chinese symbol, beautiful calligraphy that his mother had done. I had it framed on a wall in my office, and I stared at it for so long. Herb told me that this is the symbol of the carp dragon. I said, well, what is that? He says, well, the story behind the carp dragon is the carp is this fish that swims upstream. And it gets to a waterfall. And just at the point of maximum exertion and fatal fatigue in trying to get over the waterfall, just about giving up, it transforms into a dragon and flies over the waterfall. What's it going to take for us to make that kind of transformation so we can really address the sources of disease in this society? We have the best science. We need to include our highest values, our most compassionate values, and what we need to do is reorient ourselves around making sure the next generation has the best possible chance to be healthy in both a biological and a social way. Thank you.